Hello there, I'm Dr. David LeBeau, and I'm going to show you the different types of breast biopsies. There are three types of biopsies. There's a needle localization, there's a stereotactic biopsy, and then there's ultrasound-guided biopsy. The first one I'm going to show you is a needle localization. Now, surgeons also call this a lumpectomy, but a needle localization and lumpectomy are the same thing. In this situation, I'm putting a wire into the breast in the region of suspected cancer. Then the patient goes to surgery, and the surgeon will follow that wire to the area of cancer or suspected cancer and remove a lump of tissue. That's why it's called a lumpectomy. So let's draw the breast right here. We'll have cancer represented as a pink star. Now what happens is I will put a needle into the breast. For the purposes of this drawing, I'll make the needle really big. So here's the needle. And now I will put a wire through this needle. That wire typically has a hook at the end, so the wire is in good position. And now I would take the needle away, leaving only a wire. And the patient now will go to surgery. The second type of surgery I'm going to describe is an ultrasound-guided biopsy. In this situation, the patient will be laying on their back. We'll have cancer represented as a pink star. Now, in this type of biopsy, we are going to put a large needle in the breast that has a slot. This needle is about the size of a pencil. It's very thick, but will numb up the skin beforehand, both superficially in the skin as well as deep. So the only painful part is when you're getting that numbing medication. So we put the needle into the breast in the region of the cancer. Now, I'm trying to represent the slot as this. Now, a core, the needle has an internal core which chews away more and more tissue until all or most of that cancer has been removed, and then the needle system is removed. Now, the third type of biopsy, a stereo biopsy, we use the same type of needle, we numb the same way, but instead of using an ultrasound probe to guide us to the area of interest, we use a machine, and that machine is a mammogram unit. So we have a detector on the bottom, we have a camera on the top, and x-rays come through that area of interest and take a picture. Now, why we call it stereo means two. The way we figure out where in the breast that malignancy is we take essentially two different pictures. Instead of taking one picture like that, we'll take a picture from this angle and a picture from this angle, and we use the computer to triangulate the area of interest.